And the state broke another record, reporting that 96 children are in the hospital with coronavirus. That is a pandemic high. 13 on your side's Meredith Tahar spoke with Dr. Rosemary Olivero at Spectrum Health about the risks this virus poses to children. She joins us now. Meredith, what do the doctors say and what we should know to navigate through this pandemic, especially if you've got kids?
Yeah, Kirk, she said, quote, "We are seeing tons of new cases in our pediatric patients, and we are seeing a very high positivity rate right now, which of course you just reported." And she said this is also very concerning that they're seeing an increase in the number of Miss-C cases in kids. You'll remember that's the really serious inflammatory syndrome that can hit 2 to 6 weeks after having COVID-19. Listen in.
For most of the fall, we saw no cases per week, maybe one case at most. But over the past 3 to 4 weeks, we've seen at least 3 to 4 cases per week. And of course, this is important because a lot of the children who develop multisystem inflammatory syndrome do get very ill and need to come to our intensive care unit for care. So we are seeing that the COVID landscape for children is extremely active right now. And so really the main point of vaccinating to prevent severe illness and keeping up with our mitigation strategies, although everyone, of course, is tired of doing them.
She says, quite simply, children who are of vaccination age should get vaccinated, and masks are very important to stopping the spread. But as you know, that mask mandate was lifted for elementary school age children yesterday, and some districts are keeping it in place while others are making it optional. I asked Dr. Olivero if there was any chance that health departments might reinstate a mask mandate for children, and if Spectrum Health was involved in informing that decision at all. Now, she says that they work well together, Spectrum and the health department, but it's complicated and it's unlikely that a mask mandate will be reinstated. Kirk.